And I am joined in the studio by Dr. Jarrod Wiegman from Indiana Direct Primary Care. We've met him on the program before, and I asked him to come back today because of something, Doctor, you told me in a conversation about new patients. So let me just set the stage here. So Dr. Wiegman's Indiana Direct Primary Care is a different way of delivering health care. We've talked about this before on the program. No insurance. It is a relationship-based health care. So you're limiting your practice to 500 patients. And I can see you as often as I need, and all services are included under a single monthly fee. So there's the basics. And as part of this, you're seeing patients who come forward and sometimes say, geez, can I be honest with you, Doc? That really surprised me. Tell me more about that.
It's really an interesting phenomenon that I've seen in this practice that I didn't necessarily expect. I think patients have come in under a different guise. They've come in under a different understanding of what we do, and I think that allows them to open up a little bit more. I think the traditional healthcare model, where they have signs in their office that literally say you can only talk about a few things and you have 15 minutes to talk to the doctor, automatically puts people on edge, and they prioritize a little bit, and they're not able to fully give everything as far as what's underneath in their history. And I think the other part of this, too, is that when they come into our office, it's just me. Oftentimes, they don't have to see the nurse that they have to go through first. And they know that there's not, a few other practitioners in the practice that when they do come back, they may be bouncing between people. So we almost immediately develop a relationship which is different than I've ever seen before.
So the average appointment length with you, I know, can be whatever I need, right? If it takes an hour, it takes an hour. So I get it. I'm going to be a little more comfortable and more eager to talk about things. What are people revealing to you after they ask that question, can I be honest?
Anything across the board, that they're not taking their medications like they're supposed to. They can't afford their medications. A lot of things about their social history, whether it be, alcohol intake, drug use, previous drug use, things about sexuality, things about, urinary leakage. There are a lot of different things that people don't necessarily want to discuss because they find it, quote unquote, embarrassing. And they'll actually say that, oftentimes they'll say, can I be honest with you? And then they hesitate a little bit after I said, of course, I want you to be honest with me. That's the best way for us to move forward and me to help you. And they still hesitate. And then I have to go into, listen, I've been a doctor for years. I've sat with people. There's not much that you can tell me that I would be surprised. So, and I think that sets them to a little bit more comfort level because, a lot of people think that a lot of what they're dealing with is something that they just deal with. Mm-hmm. And almost always, people their generation or, they're in their same situation deal with the same problems, but people don't talk about it.
Yeah. And so let's just walk through some of those. I'm not taking my medications correctly. Tell me, why is that so important for you to know the details of?
Well, it's important to know the details because we may be adding medications. We may be thinking those medications aren't working and having to, switch to a different class of medications. We may be trying to think outside the box of, what's going wrong here? What else is in your life that's affecting this? So we're going down these rabbit holes of different things when really it's a simple answer. And if people would just be honest about it and say, hey, doc, I'm not taking this medicine because I'm having a side effect. Or, hey, doc, I can't really afford this medicine, so I'm only taking it every other day to stretch it out. Or, hey, when we first talked about it, I wasn't fully on board with this, and so I'm just hesitant to do it. And if people will tell me that, then we can talk through it. We can look at other options. We can, even sometimes delay the onset to get people comfortable with the idea of taking the medication rather than have them just not take it.
Yeah, and I suspect I'm one of those guys who's going to come to you and say, I really don't want to be on these medications. What can we do about that? If I have that conversation with the traditional doctor, I know he doesn't have time to sit and talk with me about that. What is in your practice? How does that work? If I tell you, look, I'd really like to thin down the number of medications I'm taking, does that happen?
All the time. So we prioritize essentially those medications into, I split everything in my practice into longevity. What's going to help you live longer? And then lifestyle. So we go through those medications based in those two categories. And then we'll go through medications and longevity and talk about, okay, well, what benefit are we getting from this? What are we going to see from this long term? What kind of side effects are you having from those medications? Because ultimately that may be affecting their lifestyle more than it's affecting their longevity. So we try to balance that. And I tell patients all the time, life is a balance. You can live a long time, but if it's a miserable life, is that really helpful?
Yeah. And as to that point of having a miserable life, do people open up and talk to you about what's going on with them emotionally, mentally?
Yeah, I think we have a good balance of time to be able to venture into that side of it. And oftentimes when we have initial visit, we tend to go through the health history completely. And one of those things that we, always check on that box is, how's your mental health? Where are you at with this? And people, they're kind of taken aback a little bit by that because they're not always asked those questions and they're not always given the time to give the answers to that question. And when we do talk about mental health, we're not just talking about, hey, can we chuck you on a medicine, to make you feel better, that sort of thing. We literally talk like you would in a therapist's office. And I tell people all the time, I'm not a therapist, I'm not a trained therapist, I'm not a psychiatrist, but I am a doctor and I'm somebody who can listen. And oftentimes that interaction there is just great for them because they know that I'm a professional. They know that we have that, that one-on-one relationship. They know that, anything that is in that room doesn't leave that room. It's not, talking to a friend that can gossip somewhere else. So being able to dive into that, and 50% of what we do, and I'm not kidding, it's 50% is people's mental health. Because everything in life is based on how people are feeling, and so it can affect pain. It can affect a lot of different health conditions. So if we can combat and tackle the mental health issues side of things, it really rounds out people's care.
I'll bet people are very hesitant to talk about dissatisfaction in their relationship or the stress they're feeling at work. And those things certainly do affect your sleep, your stress level. All of that affects many different functions in the body, your hormones and all the expression of those hormones in your body and the degree to which those things are being released. That's very significant.
Right, and I think a lot of times patients don't necessarily understand the biological side effects of it, but they do understand the side of it that affects their life, like you said, from sleep, from stress, all those other things. And, again, it just becomes a more well-rounded effect. And when you come to the office and you're just, hesitant to talk to your doctor about it because you have a limited period of time and they slap a prescription in front of you, and, again, that's not the ideal situation. You may need that. It may be part of your treatment, but again, a lot of it's just talking through, trying to figure out what those problems are and, working through it together. Are
you the type of guy who pushes back and says, look, you're going to have to work a little harder on this, and challenging that patient?
Yeah. So we, again, I'm open and honest with patients as well, from, treatment protocols to, things such as weight. There are a lot of doctors who don't want to talk about patients' weight for a number of reasons, I think. One is it takes a lot of time. Two, a lot of doctors aren't necessarily trained in nutrition. And three, when they do bring up weight, there are a lot of people that get very offended from that. So if you don't have that one-on-one relationship with people, you can't, give pushback as easily. But when you start to develop that relationship, people accept that pushback a little bit more to say, and take ownership of what's going on, because they don't feel like it's a judgment. They don't feel like it's a quick snap decision. They feel like you really care about them. And when they feel like you care about them, because you do, they take that criticism and that pushback with, just better heart.
What is the fear that the insurance company is somehow going to find out and your coverage levels are going to be changed? That's a real concern for some people.
It's a huge concern for some people. They don't want insurance companies to know information about them because they're afraid exactly that they're going to increase their, deductibles or their, fees that they pay. And so, in a traditional doctor's office, when you do your billing to an insurance company, you have to put diagnosis codes down. And when those diagnosis codes go to the insurance company, that's how they pay those claims out. Now, they don't often get the details, obviously, of that, and they can't really request the details of any specific visit. But when you talk about things such as substance abuse, or a lot of the different diabetes complications, things like that, people are hesitant to really want to talk about a lot of that because, again, they're afraid it's going to go and end up costing them more money.
Yeah, well, I get that. So I don't know. What is your obligation for privacy? Are you just prohibited from saying anything to anybody about anyone?
More or less. I mean, there are some laws essentially, based on mental health, as far as let's say somebody has homicidal ideations and they threaten someone. There are certain laws that we have to follow in regards to protecting those people. Outside of that, everything is pretty well protected in our office. The HIPAA justification or laws and things like that, they really prevent us from going out and talking about anything that's not related with anyone else unless a patient gives us permission.
Yeah. So one of the things that people are always very embarrassed to talk about are sexual related matters. And guys, I assume we're a little, this whole erectile dysfunction thing has kind of come out of the closet. And so that's a little more out in the open. But I suspect people still don't talk about that much. Why is it important that you know that?
A lot of reasons. One, it can be tied to mental health pretty significantly. And two, it can be tied to just your general health. Why is it happening is the big key for us. Is it because the patient has diabetes and complications? Is it because it has high blood pressure and complications? Is it because we put them on a medicine that is highly likely to cause that? Can we switch that medication? If it's a mental health issue, can we address that? And then, of course, this is a lifestyle issue for people. And if we can help them in that lifestyle category, whether it be from a counseling standpoint, whether it be changing medication standpoint, or let's face it, we've got drugs for this now, and having any stigma regarding that, it just shouldn't exist anymore. People should be able to live that life, that part of their life, the way they want to.
And women are often very hesitant to discuss something that's become a significant issue as you age, and that is pain during intercourse. Yeah, absolutely. And again, this is a lifestyle issue for them as well and their partnership. And again, a lot of what happens with mental health regarding this, because, sexual activity for people is a very close, intimate encounter. And when you have a partner and you can't share that, a lot of things break down in a relationship. So women often, just like men, feel guilty for having these type of things, and so they carry that around with them, and it's quote unquote embarrassing to talk about. It shouldn't be embarrassing to talk about with your doctor. We're here to help. There's a lot of things that we can adjust and do. There's medications that can be added. There's supplements that can be added to restore that function back to a place where it not only helps you, but helps your relationship. Sure. And I'm assuming, well, we talked about it, drugs, alcohol, that kind of stuff, people being more open to you than you think had been in the case in a traditional practice? Absolutely. I think this has been one of the bigger surprises to me, is that people, for whatever reason, the setting that we have, really feel more comfortable. Again, I think they know that I'm the physician there. They're not going to have to bounce between people. I think our office is just a little bit more comfortable. It is a traditional doctor's office, but the way we've set it up just is more homey, so to speak. And then again, I think not taking the insurance, not having that sort of factor sitting behind there, there's just a lot of different reasons why I could conjecture why that happens. But what I do know is, I've been in traditional practice for years, and, I've had a number of patients, I can't count how many, on the first visit, the first time I see them, say, "Can I be honest with you?" Is there... Is there something about knowing how much someone drinks that it changes the way you care for them, or if they use marijuana or other medications or other drugs, does that change something in the way that you're going to treat them or help them through that problem? It can, because, excuse me,
if people are drinking a lot of alcohol and they have high blood pressure, if they have trouble sleeping, things like that, we can focus on those things rather than treating them with, different medications and things. We can focus on that lifestyle issue and tell them, hey, we're not ever going to get control of this if we don't control this use. Drug use, things like that, no judgment, but, when we prescribe other medications, it's important for us to know that because there's a lot of interactions that can happen. There are a lot of, bad things that can happen when you put people on, for instance, a beta blocker and they use cocaine, that can really, put people at risk for, heart attacks. And so we don't want to do those sort of things. So just being honest about, what you're doing, it helps us kind of guide your care. It helps us not go down the rabbit holes of treating different problems when really the problem is, hey, cut back the alcohol use a little bit and you'll find that a lot of things are going to get better without other treatments.
It's interesting you mentioned weight loss and something that physicians are often hesitant to discuss. The AMA recently, the American Medical Association, recently offered guidance to physicians and saying you do need to talk about weight loss with your patients. What do you do differently in your practice around weight loss?
So one of the first things we do is we have a gym associated with our practice and we have a personal trainer there. And when we talk about people and interact with people, they know that it exists there and that that's part of our practice. So it's not a surprise to them a lot of times that we talk about weight. I had a patient yesterday tell me, you're the first doctor that's brought up weight to me in years. And she says, I just don't understand why people don't bring it up. And, we went through that process of maybe not enough time of these other things. And she goes, I don't know why doctors don't tell me I'm fat. I know I'm fat. And she told me, she's like, I know I need to lose weight. I want my doctor to help me.
Yeah.
But, that just doesn't come up because, again, she's got her 3 problems. She's got her 15 minutes, and that just isn't one of them.
So what can you do to help?
A lot of different things. A lot of times what we do is we review, again, their medications to see, what are in those medications maybe helping them gain weight. We review their supplements. We review their diet, which is huge. And then we have them meet with our personal trainer and nutritionist, and they go to the gym. They look at, what can we do from a workout, side. And it doesn't mean you have to spend 2 hours in the gym 6 days a week. Oftentimes it's, can you walk 30 minutes 3 times a day for the first go? When you change your diet, it's not, eating kale and chicken breasts and, fish. It's, what can we do in your diet? I had one patient that came in and we talked about his caffeine use as part of his social history. He was drinking 8 Mountain Dews a day.
Wow.
And not only is that a significant amount of caffeine, but that's a significant amount of calories.
Yeah, no kidding.
So just being able to say, look, I know this is a habit of yours. It's going to take a while to break this, but let's cut down 2 of those. You cut down 2 of those, that's almost 300 calories a day immediately.
Well, our time has gone again. It goes so fast when you're here. If you are in a situation where you would like to have a health professional, a physician, who is really a partner and a coach in your health, you might give some consideration to Indiana Direct Primary Care. You'll find Dr. Jarrod Wiegman at indianadirectprimarycare.com. A unique kind of practice that I'm really interested in. Love following the progress of the practice and how it's growing. If this is the type of care that you're interested in, I think it's time to take action and at least have a meeting and get with Dr. Wiegman and see, is it a good fit? Is it right for you? We'll find out. Doctor, thank you for coming.
Thanks again.